everyone, and thank you so much for sticking around for this important conversation that we've all been waiting for, and of course that is hepatitis B. And of course, hopefully Dr. Jaye is going to help us to be more aware of this disease, right. And also some of the things that we all need to learn and know. Please go ahead and tag everyone, especially men in your life. I think it's really crucial for every guy out there to listen to this conversation today. And obviously, go ahead and share this video as you watch it, and continue to comment and ask your questions. Even if Dr. Jaye cannot answer it right now, she'll definitely answer your questions later into your inboxes. So please go ahead and comment and ask your questions. Dr. Jaye, this is something that you've talked to us about before. I think you've talked to Ole about it, you've talked to me about it, and perhaps even Amy. What exactly is hepatitis B, and what do people need to know about it?
So thank you, Duka, for asking me that question. I think it's really important that people understand what is hepatitis in general, not just hepatitis B in particular. So hepatitis is an inflammatory condition that's caused by a viral infection. So it can range from hepatitis A, B, C, D, up to E. So there are all these different types of hepatitis infection. So we'll talk about all of them later, but the most important, I think, that is really affecting our community is the hepatitis B virus.
So why is hepatitis B a problem in our society? Like for us in particular?
So hepatitis B, it's also a viral infection that is caused by the hepatitis B virus. The most mode of transmission with hepatitis B is during childbirth, or through blood transfusion, or it's also considered as a sexually transmitted disease. That means if you were to be involved in any kind of sexual relationship, whether it's between a man and a man, or woman and a man, or even what we call, if I may, oral sex, or even kissing. So more of like a blood transmission or fluid transmission. So these are things that people need to understand. So when you say in our community, so back in before the 1980s, people did not used to have the vaccination, or they were not tested during pregnancy, or they were not vaccinated. So most of these men, they were born before that era. Maybe they got the infection from being delivered. So that's one of the problems, that in Africa, most of these people contracted the virus at an early age. And when you contact the virus very early on, like during childbirth, most people would really have a bad disease and may even die from it. Okay, so if the baby catches the virus around the age of 1, it's a higher mortality rate. If it's between the age of 0 to 6 years, it's even not as bad as the first year. But as you get older, if you were to contact the virus, then you can live with the virus. Let's say if you catch hepatitis B from sexual activity, you can survive the virus, because most of these people that catch the disease during their adulthood life, their immune system is strong enough where they may get headaches, body aches, just like a viral infection.
All the symptoms.
Stomach ache, all those symptoms, and not even know about it, because their immune system would fight it and they're fine and not have any issues with it whatsoever, and recover from the infection and not even know it.
It's important that you're sharing this information. And I remember hearing somewhere that actually Gambia is a red zone for hepatitis B.
Both Gambia and Senegal are both in that red zone area. So people don't understand that you can actually catch the virus and not know it, because you would just think you had a fever, or you had because most people that have these type of illnesses, they think it's a viral illness. They think it's malaria, because the symptoms are very similar. The only thing that's different from the malaria virus is that you would have jaundice with hepatitis. Jaundice is yellowing of the skin, yellowing of the eyes, and you may not even know. They would say, oh, they have there's a terminology they use back home. And if you recover within the first 6 months, it's not considered a chronic disease. Okay, you will recover and everything is fine, and your immune system builds up immunity against the virus, and you're good. Now, if it stays on longer than 6 months, it becomes chronic in your system, where now it will not you will not recover from it. So it will lay dormant in your liver, and you would have no idea that you have the virus unless you were to be tested. And you will just be going on until one day you get sick, and by then it's too late.
What's the red zone for people that are watching in layman terms?
If you look at the WHO data, the red zone basically means where the infection is so rampant and so common, and people are not addressing the issue or getting treatment because they have no idea. For those of us that come to the West, they would usually get tested if you're pregnant. Usually when you're pregnant, you will get tested to see if you have the virus in your system. And at that point, when they detect the virus in your system, they will give you treatment and make sure you don't develop the complications from the virus. But for most men, they don't get pregnant, so obviously they're not going to be tested, and they will just be living with the virus and have no idea. And the other thing too, the reason why men are more in danger, because men can easily catch the virus faster than women.
If you're watching right now, just go ahead and make sure that you share this video on your wall, because this is really important information for all of us to learn together as a community.
It's interesting that you can mention about the red zone being in Gambia and in Senegal. And then, Jaye, the other interesting thing that you mentioned though was that a lot of kids, I guess, if they get infected when they're baby, they're more likely not to survive. We've seen, I think, a lot of like men, especially like I would say like maybe Gambian men around like the ages of like 40 that suffer from liver cancer. So what's like the relationship between the hepatitis B and liver cancer?
So let's say if the baby gets it during childbirth, most of the time they're more likely not to recover from it, and they will die, and obviously they would not live with the chronic disease. But for most adult men, let's say if they get it just from kissing, okay, because that's a fluid, that's a body fluid, okay, and they carry on with the virus and they have the symptoms and don't even have any idea what it is, they live with it for 6 months and now they heal, but they're not really healed because it turns, once it's after the 6 months, it turns into a chronic problem. But the virus is still messing up with your liver. So it will be in your liver, causing the damage, and the person would not have any idea. So most of the time, these people can live with the virus for that many years and not have any idea, and they will go into liver cirrhosis. Once they go into liver cirrhosis, that liver cirrhosis, basically it's just like a scar tissue. So when the virus attacks the liver, but then if it goes beyond that 6 months, the liver gets more damage and you continue to damage the liver. You continue to build scar tissue on that liver to the point that the liver becomes cirrhosis, what they call cirrhosis of the liver. And now that person has a higher chance of developing cancer, because remember, cancer is basically a cell that keeps a damaged cell that cannot recover from the damages. And then that's why most people would not have any issues until 30 years after their infection. That's why you see so many men between the age of 35 and 42 that will die from liver cancer, because they've lived with the problem for this many years and have no idea until one day they would have this cirrhosis of the liver, they will become jaundiced, their stomach will be big, and they'll go to the hospital, and by then they see that their liver enzymes are elevated, and by that point it's already late.
Could this be the reason why a lot of men between the ages of 35, right, to 40 something die? And most of them, when you ask them what did they die of, is usually cancer. They just say liver cancer or cancer. Like I've known several men that have died, that are African, Gambian men that have died in the West from liver cancer. Ole, I'm sure you know too. Amy, I don't know if you do know, because I guess it's the age range, right? So there's a particular age where you see a lot of your friends or people that you know of are dying. And if you're watching, if you know someone, go ahead and comment, so we make sure that people know this is real. This is not a facade. This is happening to people.
Yes, Yuka. Like I said, with hepatitis B, once you get the chronic infection, most of the time people don't have any idea. And then the manifestation of the liver cancer develop over time without you exhibiting any signs or symptoms until about almost 30 years later. And that falls between the age of 35 to 42, and those men usually cannot make it by then. By the time they have liver cancer, it's already late and there is no going back. There is nothing that can be done medically to save them most of the time by the time they find out late. And that's why you see so many men between this age that are dying from the disease, which is hepatitis B, that will end up being cancerous. And there's a research that shows that the one that is found in Africa is actually does not really respond to treatment. Like the liver cancer that happens because of hepatitis B from Africa does not really respond to chemotherapy or most of these.
The cancer treatment.
Most of these cancer treatments. Yes.
So at what age do you say that a young man or just any man should start testing for hepatitis B?
So I would say there's not any particular age. If you're an African origin, okay, that's from all of these red zones, or whether you are in the West or in Africa, it is advisable to do a yearly exam. So one thing you can do, if you know you were born before 1980, and most likely there was no vaccination back then, right now there should be vaccination in Africa for all newborns. So if you don't have any idea, or if you're not sure, what you can do, you can just go to your doctor or your primary care provider and ask them for a hepatitis test. And they can actually test you. They can also test your liver. When you do a regular blood work every year, the liver panel or the liver enzymes are also tested. And if those are elevated, your doctor can do some further investigation to find out why are your liver enzymes elevated. Now, if you don't do a regular checkup, you have no idea, you can live with the disease for years. And by the time you find out and you're sick, going to the doctor, by then it's already late. There's not much that can be done. And if you're not for sure, you can actually ask your doctor to do a test.
So once you get tested and then they detect that you do have the virus, like what are some of the cures? Is it even curable, like once you have hepatitis B?
Yes, there are antiviral medications that can be given before you go into cirrhosis. There are some medications that can be given, and it's like a lifetime thing that you have to be monitored. You have to be given these medications to try to suppress the inflammation going on in your liver. That way it does not manifest into cancer. It does not progress to more of cirrhosis or even progressing from cirrhosis to cancerous. So you would be monitored. There will be continuous medications that will be given, and you'll be monitored to make sure this does not get worse.
Okay. Once your liver is okay, does that mean that you are safe, like you are free of the disease or of the hepatitis?
So you can never be, once you become a chronic disease and you have a hepatitis, it's non-curable. There's no such thing as being cured from the disease. Like you have, let's say you have the flu, you take medications and you're cured and that's it. No, once you have the chronic disease, it's still chronic and it will continue to be chronic. What you're trying to do is to prevent the progression of the disease to become cirrhosis or to become cancerous, because you can definitely put a full stop to it so it doesn't progress. But that is if you know.
What are the chances of women having it, and how risky is it for women? I know it's more riskier for men, it sounds like.
Women can still have the disease, but men are more prone because of their makeup, their genetic makeup. Just like if you were to look at HIV, women are more prone to have HIV than men, even though you still want to take protection, you still want to have the precaution. The only good thing for us in the West, like if you get pregnant, you have a chance of being tested for hepatitis. Because let's say, for example, you have a pregnant person, they get tested and you find out that they have the disease. What you can treat them, give them prophylaxis to prevent the kid from being born to have the disease. So you can protect the woman, and at the same time you can also protect the baby, because there's some medications that they can give the pregnant woman to protect the baby so they don't end up having hepatitis B themselves.
If you go as a woman, let's say you're pregnant and you get tested and then they find out that you actually have hepatitis B, right? You're married. So does that now qualify them to actually now check your husband? And if you do, are you still supposed to be having an affair with your husband, like that whole mixture?
Yes. So